This video will help you understand a condition known as overactive bladder and how to treat it. Do you rush to the bathroom to pee? Do you leak pee on the way to the bathroom? Do you pee more often than every 1 to 2 hours? Do you get up to pee more than one time at night? If so, you may have a condition called overactive bladder. Overactive bladder can affect people of all ages, but it is more common in older adults. Usually, if you see a physician or medical professional for these concerns, they will refer you to a pelvic health physical therapist. A pelvic health physical therapist is a physical therapist who specializes in treating problems related to the pelvis. They often treat people with overactive bladder. We'd like to give you a head start on many of the things that a physical therapist would share with you before you start physical therapy, known as PT, or in case you might not be able to attend regular PT sessions. Many things can cause overactive bladder, but there are a variety of things that can help you manage it. In this video, we'll share what you can do to help your symptoms, so you can get back to enjoying work, exercising, or spending time with your family and friends without worrying so much about your bladder. First, let's talk about your bladder and what it does. As you eat and drink, your body processes these things to make urine. The kidneys filter and drain the fluid into your bladder to store until it is full. When the bladder is close to being full, it sends a message to your brain that says, "Hey, I'm almost full. Time to go pee." The pelvic muscles sit like a hammock at the bottom of the pelvis and help support the bladder. They also help keep you from leaking when you're trying to get to the bathroom. When you sit down on the toilet to pee, these muscles relax and send a message to the bladder that says, "Okay, go ahead and empty now." With overactive bladder, these messages can get a bit mixed up, making it seem like you need to pee very often or causing you to leak. There are some things that we know cause people to pee more often or urgently. Health conditions like uncontrolled diabetes, uncontrolled high blood pressure or hypertension, some neurologic conditions such as stroke, multiple sclerosis, spinal cord injury, and Parkinson's disease, and certain medications known as diuretics or water pills can make you pee more often. Your physician or other healthcare professional will help you manage these conditions. They will also make sure that you do not have a urinary tract infection and that you are emptying your bladder all the way. Once these things have been ruled out or managed, there are many other ways to help your overactive bladder symptoms. So let's talk about some things you can control that will help with your overactive bladder. It's not easy to talk about these private or personal things, but rest assured, many people feel the same way you do. Many people tell us that they've stopped going out with friends, stopped traveling or exercising, or stopped spending time with family because of their pee problems. We want to give you some tools that you can use to get back to doing the things you love and to having a better night's sleep without worrying about your bladder. Let's go over some of the simple things that you can do to help your overactive bladder symptoms. First tip, drink enough water. Make sure that you are drinking fluids if and when you are thirsty. Many people stop drinking fluids because they think it will make them leak or go more often, when really this can irritate the bladder. Things like caffeine in caffeinated tea and coffee, some sodas and energy drinks, carbonated drinks like sparkling water, sodas, and seltzers, and alcoholic drinks can irritate the bladder too, making it seem like you need to pee more often or more urgently. Some people feel that certain foods like chocolate, highly acidic foods like oranges, lemons, limes, or tomatoes, and spicy foods irritate their bladder too. Keep track of what you eat and drink to see if you notice if they irritate your bladder. If they do, try cutting down on them in your everyday diet. Drinking water is always best. If you do not like water, try adding a slice of fruit to your water to make it taste different. Second tip, If you find yourself peeing more often than once every 1 to 2 hours, it can be helpful to try to retrain your bladder to hold it just a little longer each time. For example, if you pee every hour, try holding it for 10 to 15 minutes longer. Increase the time by 10 to 15 minutes until you are holding it 2 hours between pees. If you leak on the way to the bathroom or get a very strong urge to pee, try these steps. 1. If you can, sit down. If there is nowhere to sit, bend forward slightly and relax your knees. 2. Try a few pelvic floor muscle squeezes, sometimes called Kegels. Pull in the muscles around the vagina as if you were stopping your pee or lifting a marble in the vagina. Do 4 to 5 squeezes, then raise up onto your tiptoes 4 to 5 times. 3. Relax. Rushing to the bathroom can make leakage and the urge worse. Relax your brain and your body by repeating a mantra. I am in control of my bladder. I will not leak. Or use a distraction such as counting backwards from 100 or saying your ABCs backwards. 4. Do not ignore your bladder. If it's been 4 hours and you have not peed yet, try going every 2.5 to 3 hours during the daytime. This will help you get to the bathroom before you leak. Third tip, manage constipation. Hard and bulky poop in the rectum can put pressure on the bladder. Work with your physician or other healthcare professional to find a bowel management program that is right for you. Making sure you are getting enough water during the day and enough fiber in your diet can help with constipation. The American Academy of Gastroenterology recommends eating 20 to 35 grams of fiber each day. Adding in things like fruit, vegetables, and whole grains can help you poop better. If this is not enough, your healthcare professional may ask you to add an over-the-counter supplement, such as psyllium husk, Metamucil, or polyethylene glycol, Miralax. Some people find it easier to poop when they put a step stool under their feet as they sit on the toilet. This may help you not strain when you poop. Fourth tip, exercise. Getting to or staying at a healthy weight can help your bladder. Body mass index, or BMI, is a measure of body fat based on your height and weight. A healthy BMI is under 30. Make sure you are fitting exercise into your day when you can, and make it fun, something you enjoy. Walking, dancing, playing with your kids or grandkids, housework, and gardening all count. Fifth tip, stop smoking. Smoking can affect your nerves to your bladder and cause you to pee and leak more. Talk to your physician or healthcare professional about ways to help you stop smoking. Nighttime is for sleeping, not peeing. If you find that you pee more than 1 to 2 times per night, try limiting fluids 2 hours before you go to sleep, unless you need to have something to drink with medications before bedtime. Elevate your legs for 10 to 20 minutes, 2 to 3 hours before bedtime. Wear support stockings or socks during the day to help you reduce swelling in your legs. You will pee out that fluid before you go to bed instead of having to pee it out during the night. If these tips do not help, talk with your physician or healthcare professional about your nighttime peeing. If you are postmenopausal, which means it's been longer than a year since you had a period, talk with your physician or healthcare professional to see if using vaginal estrogen cream might help you. Things like vaginal dryness, pain with vaginal intercourse, sex, and frequent urinary tract infections are all signs that you may benefit from using estrogen in the vagina. In summary, lots of things contribute to symptoms of overactive bladder. We've shared with you a few things today to help you get ahead of the game and take back control over your bladder problems. If you still have symptoms, talk with your physician or healthcare professional. They may want to do testing, or they may have more ideas to help you. You do not have to live with bothersome bladder symptoms. For more help, contact a urogynecologist, a physician who specializes in bladder problems in women, or contact a pelvic health physical therapist. Here is more information on how to find a urogynecologist or a pelvic health physical therapist at Northwestern Medicine. Thank you.